So a little bit more of an advanced exercise that you can do if you can tolerate it in your third trimester or even earlier is a side step with a squat. And you can see here Specialist Mendoza has a resistance band around her hips. This is going to work those glute muscles as well as your quads. So if you don't mind demonstrating, you're going to take a couple steps to the side. Good. Keep those knees nice and wide while you do it. Beautiful. And come on back towards me. Awesome. And you should feel this working right in the side of your hip. Awesome. Another thing you can do to build these muscles is just purely work on your squats. If you have a resistance band, having a resistance band is a great idea so you can bring those knees nice and wide. Better. Good. Another very important area to exercise, especially during pregnancy, is our pelvic floor. Everyone has a pelvic floor, men and women alike. It tends to be a little bit more discussed in the female population though. So if you look at this pelvis here, on the bottom, this is where the pelvic floor sits. And the pelvic floor are muscles, just like any other muscle we have in our body. As the baby grows and puts pressure down on that pelvic floor, it stretches the pelvic floor out and tends to make it very weak. One thing that we can do in order to strengthen the pelvic floor throughout pregnancy and even after is just contract those pelvic floor muscles with what's called Keggles. To perform a Kegel, you can think of your pelvic floor like an elevator. So they're easier to do when you're sitting. So I'm gonna have everyone sit. And then what you're gonna do is you're gonna envision your pelvic floor like a sling or like an elevator. Muscles in your pelvic floor start at the very front where your pubic bone is and then go all the way to the back. A common misconception is you just need to contract the muscles in the front, and that's not correct. We have to get the entirety of those muscles themselves. So to do this, you need to tighten your pelvic floor like you're trying to hold in a flow of urine, and then imagine that pelvic floor rising up into your belly button. So Specialist Mendoza, you have had 2 babies before this, and you've had some experience with Keggles, right? Do you mind talking to that at all?
Of course not. So in my experience, doing Keggles has helped with bladder control after delivery, as well as before. It was described to me as pulling everything in together from your abdomen to the bottom of your pelvis, just squeezing it all in together to make sure you get the entire pelvic floor.
Absolutely. And I think that that's a really good point. So incontinence or loss of urine control is something that happens very frequently in moms who are postpartum, and it's not uncommon, but it's also not normal, meaning it doesn't need to happen. Most people take it as, hey, I had a baby, I'm gonna have a little bit of incontinence now when I run, when I cough, when I jump on the trampoline with my kids. But working on Keggles, working on that control of those muscles can play a really important role in preventing that incontinence or helping that incontinence if you already have it. There's 2 layers to our pelvic floor. One is superficial and one is deep. And we want to make sure that we get both of those layers. Can you hold that for me? Thank you. We want to make sure that we get both of those layers when we're working out our pelvic floor. So we're going to do them together. Kegels are a hard exercise to do because they're not like a bicep curl. You can't see those muscles contracting. But you can do slow holds where you imagine that elevator kind of riding all the way up to the top in your belly button, really holding those muscles in, holding for 5 seconds, and then relaxing. So that's one layer of those muscles. And then to get the other layer, we want to do quick contractions. So you contract, relax, contract, relax. And remember that we're contracting all the way from the front, all the way to the back. This can be really, really helpful also for recovery postpartum. Things get really stretched out during delivery, and this is a great way to start waking those muscles back up. One way to test to see if you're doing your exercises correctly, or you can sit on the toilet, and while you're urinating, you can stop the flow of urine. This is not something that I recommend doing more than once because you can cause a UTI with this. But just doing that exercise to make sure that you're contracting those muscles correctly is a good cue for yourself. Okay, I'm doing the right thing here. Sexual health is another really important topic of discussion when it comes to postpartum women, and I think sometimes it's a little bit of a taboo subject. Getting back to a good sexual life with your partner is really important. It's an important part of who we are as people. And Keggles, which we just talked about, is a really great way to help get back to that normal sexual function. Oftentimes after delivery, there's a whole variety of sexual dysfunctions that people can have, whether it's pain with intercourse or challenges in the bedroom. And one of the ways that we can decrease that is work on the strength of that pelvic floor muscle in order to help things overall, help the strength of that pelvic floor, and help you recover from the delivery that you had. So one way that some of the women that I've worked with have found is a good cue to know that they're doing their exercise correctly is that when you're having intercourse with your husband or your partner, I want you to do your Kegel. Your partner should be able to tell you if you are doing that Kegel correctly. And remember that men and women alike can do Kegels, so you can do Kegels together. Specialist Mendoza has told me that she's had success with this method of trying to get back to that after delivery. I think that that's a really important thing to try to work towards, and know that Kegels are a great way to get there. If you are still having issues in this area, there are pelvic health physical therapists who can help you get back to your normal activity. And one way to get to a pelvic health physical therapist is to reach out to your primary care manager, reach out to your OBGYN or to your midwife, and they can give you a referral to where you need to go.